Hello and welcome to today's Cancer Biomedicine undergraduate open event. Thanks very much for joining us. My name is Diany Lang and I'm a current Cancer Biomedicine student here at UCL and your chair today. We hope that you had the chance to watch our Faculty of Medical Science Open Day video on our website and that this Open Day Q&A session will address those course-specific questions you may have and will help you gain an insight into what it really is like to study on our Cancer Biomedicine undergraduate program. So today, our speaker, Dr. Ursula McGovern, will introduce you to the exciting field of cancer biomedicine, followed by an overview of the program structure available here at UCL. There will be a Q&A section and plenty of interactive opportunities for you all to join in throughout today's event. The session is being recorded and will be made available following today's event. We're here to respond to your questions, so please share those throughout using the Q&A function on Zoom. Now to introduce our speaker, we have Dr. Ursula McGovern, who is a consultant medical oncology at University College London Hospitals. In her role as a UCL Honorary Associate Professor, she runs the oncology teaching program delivered by UCL Medical School and is the undergraduate program lead for the UCL Cancer Institute, helping to train and encourage UCL students to become the cancer physicians and researchers of the future. Thank you. Dr. McGovern, now over to you.
Thanks, Jenny. Welcome everyone who's watching this today. So I'm going to talk to you a little bit about our Cancer Biomedicine degree at UCL. And as Yanni mentioned, I'm a clinician, so I'm a medical oncologist. I work at UCLH, but I'm also the lead for the undergraduate teaching that's delivered by the UCL Cancer Institute. So just to start, sorry, I'm just going to move my slide on. So thinking about cancer in 2024 and why is it relevant? Why do we think this is a really good degree for our students to study? So cancer is a really common condition. We know that. I think probably anyone who's watching this or listening to this will know someone who's been affected by cancer. And just think of the news headlines lately. We have in the UK, we have the King and the Princess of Wales both receiving treatment for cancer. So this is the common condition. And I think if you're remotely interested in the sciences or those affiliated careers, cancer is very relevant. It's a disease process that you can apply across other diseases as well. So, we think about cancer for a lot of patients now as a chronic condition, perhaps a bit like diabetes or airways disease. So a lot of what we learn about in cancer is applicable to other disease processes. And, people ask me, what do I think of the changes that are happening within cancer? And there's no doubt we are really starting to move towards a much more personalised treatment for cancer. So it's a really exciting time to be involved in cancer research because we're not just looking at cancer as a disease entity across the board. We're looking at individual patients and what can we do to give them really good treatments for their cancer. So I always suggest people say, well, what reading can I do about the course? Where might I find some interesting facts? Well, the Cancer Research UK website is a real big wealth of information about cancer patterns in the UK. And just to try and put, some of these statistics in concepts, I've said cancer is really common. Okay, so we see lots and lots of cases every year in the UK, but a lot of patients survive a cancer diagnosis. So that's a really important take-home message. This is still a very curable disease. And if we diagnose cancer at an early stage, our patients are likely to do very well. So they're going to survive their cancer diagnosis. And there's a lot that we can do to prevent cancers as well. So again, we sort of quote this figure in the UK of perhaps about 40% of cancers are preventable. So if we just change some of our lifestyle habits and improved some of the things that we do, we're likely to reduce the amount of cases we're seeing. And, it's always in the news, isn't it? So I mentioned the King and the Princess of Wales, but, there's always news about new cancer breakthroughs, some research that's been developed or access to new drugs or risks for cancer. So this is a really topical thing to be involved with. And it's, it's a really interesting field of study to go into because it's always out there. We're always seeing things on the news and in the newspapers about cancer. So if I think about how prevalent a disease it is and why I think this is such a relevant degree, we are now in the UK saying that half of us are going to hear the words "you have cancer" at some point in our life. So that's a really scary figure, isn't it? 1 in 2 people in the UK are going to get a cancer diagnosis. So, I'm really hammering home how big a healthcare problem this is and how prevalent a condition it is. But our hope as the Cancer Institute and as training you guys as the future cancer researchers, we're hoping that our statistics are going to continue to improve. So, I talked about 50% of patients surviving a cancer diagnosis. Well, we want that figure to go higher. And, we're seeing this perhaps in the next 20 years. We want to say that, 75% of our patients who get a cancer diagnosis are very likely to survive that. So we want things to continue to improve and the outcomes to get better and better for our patients. And I've talked about, very prevalent conditions. So, we're talking about a lot of patients who get a cancer diagnosis, but really, really important to keep hammering home as well that more and more patients are surviving. And that's because of cancer research. A lot of the work that's going on in the UCL Cancer Institute and in the labs that are affiliated with our local hospitals, they are doing lots of really exciting work that is helping to improve the outcome of our patients. So yes, we're seeing lots more cancer patients, partly because we've got an aging population and the biggest risk factor for cancer is age, but our treatments are getting better, our diagnostic tools are getting better, and our knowledge about cancer is improving, so more and more people are getting a better outcome and surviving. So in terms of our degree program, so what are we trying to do? So we are trying to educate the cancer researchers of the future. And how do we think you as potential students in our course are going to contribute to developments in cancer? So what do we try and teach? So we want our students to have a good understanding of how and why cancers may develop. We need to be thinking about screening for cancer. So we know the earlier we diagnose cancers, the better the outcome up for our patients. So we want to be screening for cancers earlier. We're always looking for new treatments, so novel treatments, how are they going to work? What are the side effects? What patients should we be giving those drugs to? That's a lot of the work that's going on with our cancer researchers. And one of the biggest problems we have in cancer treatment is resistance. Our treatments will work for a while and suddenly they stop working. Well, how are we going to stop that from happening? How do we stop resistance to current cancer treatments? And that goes along with testing new drugs. So we're always looking for new developments. We want new treatments that perhaps have less side effects. So that's the role of the cancer researcher. And we talk about this concept from bench to bedside. So we think of the work you do at the scientific bench side eventually is going to be brought into the clinic and it's going to be given to our patients, and it's that real translating what you do in the scientific world into healthcare. And particularly at UCL, there's such a strong link between what goes on in the research institutes and what's going on in our hospitals and in our cancer clinics. So it's a really important concept, translating from bench to bedside. So a little bit about the degree program. So I've said that we're trying to train the next generation of cancer researchers and biomedical scientists. And, we like to think of this as a really relevant and stimulating degree. There are not many degrees in the UK that are cancer specific. So we were pretty unique when we first started up. And what we're trying to do is equip our students with skills to carry on the innovation that's been seen in cancer research and to plan for the future. So we want those statistics to continue to get better and we want the outcomes to continue to get better for our patients. So a little bit about the course, and again, you'll get more information about this when you look through the prospectus, but what we've done, so if you think about year 1 of Cancer Biomedicine, so you are taught with other programs within the faculty, so that's shared with the other applied medical sciences. And in that first year, you learn things about the basics of biology, anatomy, biochemistry, physiology. I think, we feel it's very important to understand diseases such as cancer. You do have to have an understanding of the normal pathways and the normal function of the human body and different cellular pathways. So you learn a lot about the basics of biology, etc. And we do introduce cancer medicine in that first year. So our students get a taste of what they're going to get in the subsequent years. So we do a module called Cancer Medicine in Society. That's sort of setting the scene for our students, looking at cancer as a disease in society. How do we fund the drugs? How do we decide who gets what treatment? How do patients cope with a cancer diagnosis? What's the psychological impact? That's a really important basic stepping stone into year 2 and year 3. So we always have to remember, you know, in addition to the science, we have patients at the core of all this who are living with a cancer diagnosis. So that's that first module. And then as you go into year 2 and year 3, we become a bit more cancer specific. So you start to do some core modules where you learn about cancer biology, how we develop new drugs. We do some clinical modules where you perhaps follow a cancer patient through their treatment and you see how we make decisions about different options. You'll learn about clinical trials. I spoke about precision medicine, so personalized medicine. So starting to think about things like targeted treatments. How do we select patients for particular drugs? Radiation, very important modality for treating cancer. We have optional modules about radiation. And then in your 3rd year, you have other optional modules. You can learn about pediatric cancers, nutrition, virology, lots of different things that cancer related. And I think one of the strengths of our course is that you do have some optional module choices as well. So you don't have to do every single module related to a cancer theme. We know that some of our students have other interests such as pharmacology, global health, statistics. There's lots of different optional modules that are sort of they dovetail quite nicely with what we do. So we do try and be flexible, and you can choose some optional modules as well. And then your final year, one of the big bits of work that you do is your research project. So for most of our students, that would be a cancer-specific module, often in the Cancer Institute, and you'll spend a period of research doing your lab work, and then you'll write a dissertation on that. So the year 1 is sort of general principles about health and disease, and then year 2 and 3 become much more cancer-specific. And what do our students tell us about the course? So we've been going for probably 5 or 6 years now, maybe a little bit longer. So still quite a new course, but our students tell us, they like the fact that they interact with scientists and clinicians on the course. The research project is a time where you can become really quite specialised and learn something really in depth about a particular field of cancer research. Our students are doing well, so they have future employability when they graduate. And I mentioned the optional modules, so we're always open to allow students to do certain modules if they've got particular interest. So we're a little bit flexible compared to other courses, which is a good thing in terms of the choices you have. And I've just put some quotes in here from some of our previous students. So this is feedback that we've had from some of our students who've already taken the course. They found it relevant, they found it interesting. They're learning a lot about cutting edge cancer research, and they're getting to work with big names in the field. So that's really enjoyable if you've got future career plans for science and research. And good for us that we're here, staff and teachers have been supportive. So we're a small course and we intend to stay a small course, so around 30 students maximum. So we get to know our students quite well, they get to know their teachers quite well. And we'd like to think that we're very supportive, and will help our students as they progress through their degree. And the Cancer Institute, so I put this photo on this slide because I talked earlier about this bench to bedside approach, and you can see on the left-hand side of this picture is the UCL Cancer Institute, which is absolutely internationally renowned for the quality of the research that it produces. But you see directly across the street is the Macmillan Cancer Centre, which is where I do my clinic. So that's where the patients are coming. So a really close bond between the research and the clinical work. So very, very important that we all work together. And there's a lot of people in the UCL Cancer Institute who are clinicians and also work with patients. So very close collaboration between the science and the clinical community. And we all work together because we want to educate our next generation of scientists, cancer researchers and cancer physicians as well. And I always say, you know, we are a well thought of, internationally renowned institution. And I've just put a few examples here of some of the work that's been coming out from the institute. So Charlie Swanton and Marion here, who was on the front of this supplement, you know, a lot of the work they're doing about the evolution of cancer is really groundbreaking. This is a group of researchers that I think in the last year had about 10 Nature papers, you know, really, really successful groups. So these are the sort of people that you'll get the opportunity to work with. And some of you who've been reading around the field a little bit will know a little bit about CAR T cell therapy. That's looking like a very exciting option at the moment, where we're starting to look at the immune system to help fight cancer. And that was a treatment that was pioneered again at the UCL Cancer Institute. So we're very proud of our achievements. And when I say that we are internationally renowned, it's true. We are a really, really important, groundbreaking institution that's making a lot of important discoveries. So another question that we often get asked is, you know, well, where do our students go next? So a lot of our students want to stay within cancer research, which is great. So they go on after their degree to do an MSc, or they go on to do a PhD. This will equip our students to stay in the biomedical sciences. So you don't have to stay within the cancer field. You learn enough about the other affiliated sciences that you have the skills to go into other specialties. Some of our students think about graduate entry medicine, or could go into the pharmaceutical industry, or healthcare, working in clinical trials, etc. So we've had a lot of good success with our students going on to good employable options after they've completed their degree. And, you know, it's not just about, you know, getting out of this with a good degree. Obviously, that's what everyone wants, but we want to give you other skills as well. So it's things like personal development is really important to us as you go through your degree program. So we've talked about trying to be supportive and listening to our students and reacting to feedback. We're going to give you skills in leadership management. There's lots of opportunities within UCL to get involved with extracurricular activities and to help us improve things for our students. Careers advice, you get a really good foundation in the biomedical sciences and lots of research skills and communication skills. So we're hopefully equipping our students with lots and lots of good skills when they finally graduate. So just to finish, this was one of our first cohorts of Cancer Biomedicine. So it's been lovely. The last few years, we've been able to go back into in-person graduation ceremonies. And it's so wonderful to see students, you know, after all that hard work, to graduate and to really enjoy the day and to be going on to bigger and brighter things and a great future. So, you know, if you pick this course, this could be you in a few years. And, you know, it's a wonderful achievement, and it's a great for us as a department. So a few other little bits just to finish, but you'll get lots of this from in the prospectus. So entry requirements here. So 3 A's at A level, biology and chemistry required. But I'll put the link in there so you can find a little bit more detail about what the requirements are in terms of entry. So very happy to take any questions, and I've just put some key contacts there. So I'm the undergraduate lead for the Cancer Institute, and Thiru is the program lead for Cancer Biomedicine. So very happy to be contacted. We have an administrator as well if you've got any queries you want to email us about. But I think what I'll do now is I'll come off the slides, and if there's any questions from anyone, we'll be very happy to take them.
Just to kickstart the Q&A section, I'll talk a little bit about any advice I'll give to someone applying for cancer biomedicine. I think go for it if your interest aligns with our program. I think this is a really great course, as what Dr. McGovern said earlier. It does cover a lot of different aspects of cancer research and treatment, and there are also optional modules for you to maybe broaden your interest and to just explore. So I think really go for it and read more about cancer treatments or news in the field as well, so you're better equipped about what's going on. And being a student in London is really fun because you are in central of London, and you're close to so many different facilities and events. And something I really like about London is that there's a lot of free museums. So even UCL has our own smaller museums, right? So it's always fun to just explore and go around London. Yeah. And a little bit about what I enjoyed the most about the course. I really like how interactive it is because we get a good mix of tutorial sections to really help us consolidate what we've learned in lectures. The thing is we get a lot of support about those. So that's what I enjoy the most about the course. Yeah. Mm, we also get transition mentors and personal tutors to really help us through getting used to university and like give us tips and just counsels for any ideas about the future as well. So yeah. Mm,
I think there's a couple of people with us at the moment. It might be interesting just to know what you're studying, if you're brave enough to put your mics on, or you can use the chat. We've said that chemistry and biology are essential. I think they're particularly helpful in year one, just with the foundations. Just while people are maybe thinking about questions to ask, I often get asked about how students could prepare for the course, and I think there's no direct reading material that you have to use. I mean, I mentioned the Cancer Research UK website. I think that's a really helpful site to look at. To learn a little bit about patterns of cancer in the UK and treatments and global incidence of cancer as well. The other thing that might be a good thing to read is The Emperor of All Maladies, which we sort of talk about as the biography of cancer. It's a bit tough going, the book, but it's worth reading because it sort of tells you how we've got to where we are within cancer. And actually, we study the documentary of Emperor of All Maladies in that Cancer Medicine Society module I talked about in year one. So, if you do want to get a little bit of grounding in cancer treatments and different discoveries and how how chemotherapy evolved, how he discovered radiotherapy, that might be a good book to read to get an idea of where we're at with things. Yanni, how much, in terms of sort of study time, how would you say your sort of week works out in terms of tutorials versus private study and things?
I think that there's quite a lot of private study time compared to maybe busy schedules in like high school. We don't have that anymore. We just have like different lectures throughout the week and they're pretty spread out. So we do have time to maybe go to like student centers to just revise after your lectures. But we also get storylines and reading materials that we have to do before lectures. So it's just that just because we don't spend a lot of time in class, we also have to work outside of class. So yeah, but it's not like it's very stressful, but we do have to put in enough amount of work. Yeah.
People sometimes ask us about assessments and what they're like. So we try to have a mix of different assessment tools. So it's not just all multiple choice exams or all essays. You'll have things like poster presentations. You'll have group work. There'll be tutorials where you present cases. So we mix up the different sort of assessments that you have, which if you perhaps feel, oh, I'm not very good at writing essays, well, that's fine because there'll be opportunities to gain good marks in other different formats. And again, the teaching is a sort of mix of, as Yanni said, there's lectures, but there's small group teaching, there's tutorials. Virtually all of what we're doing now really is face to face in person. So there's a lot of opportunity to interact with your colleagues. And with faculty as well. So a nice mix of things. And the other one of the unique things about our course as well, I talked about the different modules that we do. So what we tend to do within Cancer Biomedicine, you do the module, you finish it, and then you do the assessment. And that's quite popular again with students because it means you don't sort of have this bunching of lots of assessments at the end of the year. You get examined as you go through the modules. So that's something that some of our students feel is helpful in terms of sort of not getting under too much pressure at the end of the year.
Yeah, I agree with that. So when I choose my modules, I look at which modules are in each term. So things are pretty spread out throughout the school year. And I think that the different assessments are really helpful because they help us consolidate even our soft skills. So poster presentations or like group work are things that we have to use in our future careers as well. So it's really nice to have a different variety of assessments and to also train yourself on presenting your ideas in like a poster and A0, a big poster. So it's really nice to have different, like a mix of assessments. Yeah. And we get a pretty small cohort. So we are pretty close knit and you get to know everyone around you pretty friendly because well, it's a pretty small cohort. So you get a chance to like mingle and like chat with everyone. As when I first came to London, I was actually quite anxious because I'm moving away from all my friends back home and going alone to a new country. But I think the support from UCL, if they really give you support on making friends. So we get to have a lot of clubs and societies. And as I said, we have transition mentors. So smaller groups with maybe seniors, maybe second year or third year students in cancer biomedicine. And in these small groups, we can have more opportunities to just, make friends at the beginning of the term. Yeah, so that's great. If you decide to stay at UCL accommodations, sometimes they'll also hold events for you to meet people living around you. So there's really a lot of different opportunities to get to know the people and just to make friends. Yeah. We're happy to close the event early if we don't have any further questions. Thank you for an excellent session and sharing from Dr. McGovern. And I guess that's it for today. Thank you all for joining.
Thanks, everyone. Bye.